Next, IV medications and IV fluids. When it comes to fluid administration, we're going to slow that administration down. Give boluses over 30 minutes unless the child is actively coding, then we're going to resusc immediately and bolus fluid into them. Otherwise, be aware of how fast we're putting the fluids into them. Make sure it's clinically appropriate and the patient's responding to our fluid resuscitation. But in general, on these patients, you want to slow the administration down a bit. Next, take great care when performing suctioning on these neonates, no more than 15 seconds. Make sure we're not sucking out oxygen. We're causing hypoxia with this. And limit the frequency of suctioning too. We do not want to overstimulate this neonate. Next, limiting stimulation. That includes noise. So cell phones, answer the alarms quickly. Don't go into the isolette unless you have to. Cluster your care, so you're performing all your procedures at one time and you're not going in and out of that isolette bothering that child. People want to come see them? No, you can't. So again, limit the stimulation of this child. We need them to rest. Next, try to avoid prolonged crying. I usually don't cry that long, so I don't think I'm the baby. Yeah, if they're crying and they're jacking up their ICP, so we want to minimize their crying and address their pain. If you feel the child's going to be in pain because of IVs or other interventions, please address pain management in this child. Now, if you're using a UAC for blood gases, awesome. Remember to draw slow and to flush slow, over about 30 seconds. Try to take about 30 seconds to get your sample without compromising the integrity of the sample, but go slow. 30 seconds for the draw, 30 seconds for the flush. Okay, so this has been what is an intraventricular hemorrhage in a neonate and steps that we can take to help minimize this happening. My name's Mark, thanks for watching, see you in the next video.